Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Welcome to a brand new episode of the Empowering Plans Podcast. This week, you've got a couple special guests. Instead of our regular hosts, you've got me, Nick Bonds, one of the attorneys here at the FIA Group, and joining me today is another of our awesome attorneys. You've got Andrew Silverio. Say hi, Andrew.
Hello.
Hey, bud. I think it's been a minute since you did one of the podcasts, isn't that right?
Yeah, I did one with Chris Aguiar a couple months ago. Time is meaningless nowadays. But yeah, it was a good time. Good to catch up with him. He sort of guided me through Subro in my early days of FIA. So yeah, it was good to catch up with him. Good to chat a little bit.
Cool. And then you kind of transitioned over to the consulting side with me.
Yep. Yes, sir.
Cool. Well, one of the reasons I wanted to do this podcast with you today is we have kind of an interesting topic. We're going to talk a little bit about right to repair and what that kind of means in the healthcare context. And I think you and I are probably two of the better suited attorneys here at the FIA Group to talk about this because we both have a little bit of a background in intellectual property law. I did an IP concentration in law school, and I think you did as well.
Yeah, I did an IP concentration, and health law was sort of a minor, if you can call it that.
So you kind of fell back on your healthcare studies to come to us at the FIA Group.
Yeah, that's right. I gave up on my dream of being a rock star, which morphed into being a lawyer for rock stars. And now I'm here with a bunch of health rock stars.
Well, we're glad to have you. That's sort of a similar trajectory I had. I wanted to be a big shot IP lawyer, and I wound up more in the healthcare space, but I think we're better off for it. So one of the things that kind of you hear popping up in the IP and a lot of tech spaces lately is this kind of buzzword around right to repair. And that's sort of growing as a big bugaboo in the intellectual property field. There are a lot of people who are pushing for it, but a lot of people have kind of arguments against it and see it as a potential threat to certain intellectual property rights. But I thought we could start just sort of by talking about what right to repair actually means. Do you want to jump in with kind of a summary?
Yeah, sure. So when you sent this idea over as a topic for the podcast, my initial thought was right to repair. What does that have to do with health law? Because, living in Massachusetts, we just went through a whole process of a right to repair bill. And anyone living in Mass or living in a state who's passed or considered even a similar bill, we were just drowned with the ads for months, sponsored by the auto manufacturers on one side and associations of repair shops on the other side. So to me, right to repair for a long time, it just had to do with cars, right? It's the ability for a consumer to take their car to anyone they want to fix it. A couple decades ago, it wasn't an issue because everything is, mechanical. If you know how to fix a car, you can fix a car. But as things become more and more technologically advanced, and even something like a blender, it's got some sophisticated electronics and computer chips and that sort of thing. The manufacturers are finding ways to sort of monopolize the ability to repair these devices, or even just make them impossible to repair at all, so that a consumer has to just purchase a new one. So it gets a lot of exposure in the auto industry. Of course, there's a lot of money there. If you look at the little fine print at the bottom of those ads, you'll see, names like Toyota, Mazda, Honda. It's not small donors pushing back against right to repair laws.
You mean there's not a grassroots anti-right to repair movement?
Not that I know of, no. But yeah, it applies in all sorts of contexts. Consumer electronics. You've all probably heard of jailbreaking a phone, the ability to repair a smartphone or small electronics like that, and the concept of voiding your warranty if you open something up. Those are all ways for manufacturers to kind of monopolize the ability to repair those devices or just prevent it altogether. And yeah, so that brings us to why are we talking about this on the FIA Group Empowering Plans podcast? We don't sell phones or cars or repair phones or cars. So Nick, what gives? What are we talking about here?
Well, I think that first off, you must be buying much fancier blenders than I buy because I don't think that my blender has ever been connected to anything. But yeah, you're absolutely right. It's maybe not an immediately obvious connection to the healthcare space, but when you think about all the stories that we've been seeing about how the pandemic over the last year and a half now has impacted hospital systems. One of the biggest problems that they've had is a lack of, medical devices for treating patients like ventilators, especially, or even devices for diagnosing and helping figure out what's wrong with patients like MRI machines and X-ray machines and scanners and all of those really essential medical diagnostic and treatment devices are all sort of wrapped up in the same concept of right to repair. And just like a car or Andrew's fancy blender, a lot of these really essential medical devices are sort of tied up in contracts and software restrictions that do a lot to prevent the hospitals themselves from being able to repair or support or do maintenance on these machines, and even prevent them from going to third parties like any old auto mechanic to service these devices, which means that a lot of these manufacturers have something of an effective monopoly on the maintenance and service of the devices that they're selling and leasing to hospital systems, which just makes them, ever more expensive as these devices, especially in the case of ventilators, that some of them may have been in a closet or on a shelf for years, having to be put into such heavy use with hospitals filling up due to the initial waves of the pandemic and now the new Delta-fueled surges in caseloads that these hospitals are dealing with. The medical devices that they rely on are seeing a lot more wear and tear and needing service. And I think that that's a big part of what sort of spurred this new push in the right to repair movement. And the big sort of pillars of any piece of right to repair legislation or regulations are sort of that the manufacturers have to make information available on how to actually go about fixing and servicing their products. And they also have to make the tools and components, all the necessary things that you need to actually perform that service and maintenance available. And that's something that's sort of been addressed in a new executive order from President Biden. Do you want to dive a little into the EO?
Yeah, so, like any EO executive order, it's not necessarily law. It's a directive for different departments to create some regulations, some guidelines, and it's more of just an announcement of policy. But we're already seeing, just based on this executive order, which came out about a month ago now, July 9th, different industry advocates talking about, providers reaching out to these manufacturers to renegotiate contracts and that sort of thing. How willing are they going to be to do that? Them being the manufacturers, we don't know, but those types of requests will have a lot more teeth when regulations follow up this executive order, actually requiring, something substantive as far as making this information available. So we think about some of the most expensive services in the medical realm, some of them unjustifiably so, arguably, if you're talking about certain types of advanced imaging. Some of that cost is attributable to maintaining that big, expensive MRI machine. Or we see issues with the cost of robot-assisted surgery. Those robots are expensive, and the manufacturers of those robots, they do a lot of work to make sure that if something breaks, if some small piece breaks, the hospital can't just replace it on the cheap. They can't just hire someone to come in and fix it. They have to go back to the manufacturer, who might advocate for replacing something bigger, replacing the whole thing, sending in their own technicians to fix it. And some of the rationales behind that, you need to justify it somehow other than just, we like money. They want to make sure, and there's validity to this, that their machines work properly, getting proper authentic parts. Because if, for example, something like the Da Vinci surgical robot, if you're having unscrupulous repairmen working on these cheaply and sort of improvising, eventually you could have negative patient outcomes, and that's going to reflect poorly on the manufacturer. They have a legitimate interest in trying to prevent that from happening. But, how much of that is smoke and mirrors? I'd go out on a limb and say at least some, for sure. It's, been about striking that right balance.
Yeah, and I think there's a good argument too, unlike a person's smartphone or a smart blender or a TV or a few of these other, consumer electronics or even cars, devices that are typically caught up in the right to repair discussion. Medical devices like your MRI machines or your surgery robots or your dialysis machines, I completely understand sort of a higher level of hesitancy over sort of having, any old third party mechanic show up to service that because it could also reflect pretty negatively on the hospitals themselves. But I think that also shows that the hospitals kind of have a vested interest in ensuring that these devices are properly serviced and maintained by licensed third parties. And I think that would sort of have to factor into any right to repair requirement, that there would have to be some sort of certification or some way to confirm that the cheaper third party person that you go to that could service these machines would be, servicing them up to the same level that the original device manufacturer would be doing.
Yeah, that's an interesting counter argument there to those manufacturer anti-right to repair arguments, right? The customer, the hospital, the medical provider, they care about patient outcomes and safety just as much, if not more, right? So that sort of loses ground a little bit when you look at it from both sides.
And just to bring it back to our ultimate intellectual property bona fides, I think that one of the big arguments here too is that there's an inherent risk that literally opening up sometimes these devices to be seen and worked on by third parties and being required to make that kind of information available. I completely understand a certain device manufacturer's sense that is going to expose, their protected intellectual property they may have patented or trademarks or copyrights on, that's going to inherently put their intellectual property rights at some risk. But I think that has to be kind of counterbalanced against this, essentially a mini monopoly that these manufacturers have on their devices. It seems pretty intuitive that once a hospital or a hospital system or a private practitioner even buys one of these machines, that they should be, they should have the freedom to maintain and repair that machine in whatever the most cost effective and best way for their patients that they can possibly find. And I think we can all agree on that. One thing that concerns me too, though, is that there's really no guarantee that if hospitals start saving money on their medical devices once right to repair legislation become a reality, there's not necessarily any guarantee that they'll pass those savings on to consumers, but I do think they will for sure be passing on rising costs associated with these devices if the device manufacturers don't have to comply with some sort of right to repair regulation. Do you think that's sort of a fair reading of the ground here?
Yeah, absolutely. I mean, it would be great if, across the board, provider costs go down 20% and then, poof, the bill charges go down 20% as well. We know it's not going to work like that, especially if it's sort of something that flies under the radar of the public eye. If you don't have widespread awareness of something like a new sweeping right to repair legislation that brings down provider costs, I wouldn't, call me cynical, but I wouldn't expect the hospital community, the provider community to just take it upon themselves to toss away all those increased profits and past savings onto customers. But yeah, if costs went up, you could bet on charges going up as well.
Well, there you have it, folks. Us here at the PIA Group doing our part to shine a light on right to repair requirements coming to you soon. Andrew, any other thoughts you have before we kind of wrap it up for the day?
No, nothing here. I, for one, would like to thank you for a 15-minute break from COVID-19 regulations. I'm sure we'll be right back on them next time.
Yep, that sounds all right. Thanks, Andrew, and thank you, Pat, for being our maestro getting this recording together. And thank you all our listeners. As always, any questions you have or follow-up concerns, you can always reach out to us at the PIA Group. Thanks, everybody, and have a great day.